Welcome back to EASD TV. Now, one of the things that we've been doing in our studio is having a look at futures in particular topics. And I'm delighted that we've got Annette Ziegler from the Helmholtz in Munich to talk to us about the future of screening for type 1 diabetes. So welcome, Annette. So lovely to see you again. So what might be the future for screening for type 1?
We really hope that we can establish screening for early stages of type 1 diabetes in many European countries because we think that it's really a benefit for children especially to be diagnosed early because we can prevent serious complications that occur if somebody is diagnosed too late, but also many other benefits in terms of no need to go in a hospital, not having symptoms when your diabetes is diagnosed. And we are very lucky that actually the European Union has granted us some funding for a European innovative health initiative project, and the name is Identify. And with this project we would like to and we want to establish screening in many European countries, including Poland, Czechia, UK, and Denmark, Sweden, Germany, Italy, Portugal. And so I think that is really the start of a new area.
And what age of life are we going to, and how was it going to be done?
It's children mainly, but we will probably explore screening at different ages in different countries. The best performance of screening is really early. So if you screen once or twice, the best years to identify children is already in the years before school starts, 2 to 3 years of age, 5 to 6 years of age. That would be the best, but I think some countries would also like to get some experience in screening older children and adults, and also combining the screening with other autoimmune diseases.
And what are you looking for? Is this an antibody screen?
This is an antibody screen, and with this antibody screen we can identify children that or adults that are not yet symptomatic, that have this early stage of disease, and that is of course also enabling us to start new therapies to prevent diabetes. And we are very, very lucky that there is a new treatment available in US, teplizumab, that can delay diabetes by at least 3 years. TILT, that is a treatment that we also hope very much is some in near future available in Europe. And so that screening is not a standalone, it also can be combined with treatments.
And we've seen a very interesting paper presented here about giving antivirals to children with type 1, which was the kind of opposite and completely counterintuitive, but they had some good results.
Yes, but it has actually been discussed for many, many years that viruses play a role in the etiology of type 1 diabetes, and we are very interested actually in antiviral treatments. Probably all along it would be more effective to give such a treatment very early, and that is also a possibility when we diagnose earlier, to give it actually long before the clinical onset. In this paper you're referring to, the people had already diabetes, but it was good to see as a concept that even at that stage there was an effect.
You and I have talked before about another development. Screen for Care is the major European whole genome sequencing of newborn program, and Genomics England, with whom I have a relationship, has just announced its conditions list for its whole genome sequencing screening of newborns, which will be 100,000 newborns right across the UK. And that includes quite a number, I think at least 6 or 7 diabetes variants.
Yeah, no, I think that is also something that is absolutely to consider in the future. We are very much also engaging into primary prevention, and that is only possible if we screen for genetic risks. And we have, I think, over 80 loci already in type 1 diabetes. And we have actually, in fact, also genetic risk scores that we can screen with. And therefore, I think this development is extremely interesting also for type 1 diabetes as a disease, and how we can use that and implement in the future.
Because even if you can't obviously give these very powerful drugs, but what you might do is some of the things like institute monitoring on a very regular basis. So at the very lowest level of antibody you can give new treatments, or you might do things, I guess, like rotavirus vaccination, all those kinds of things.
Yes, I think we are actually doing some interventions that are antigen-based therapies. We tolerize with insulin. We give oral insulin immunotherapy because insulin is the first antigen that is attacked by the immune system in type 1 diabetes. So we try to tolerize very early. We have other studies where we use a probiotic very early to influence the immune system. Exactly.
Yes.
And I think we are also really looking at vaccinations against viruses, because that would be also a possibility to very early in life, of course, to prevent some specific infections that may attack the beta cell.
So that's type 1 in children, and as we've been discussing quite a lot in this studio, actually type 1 in adults is becoming more and more common. It's not simply a childhood disease as we always thought, perhaps a long while ago. So what about screening for type 1 in adults?
This is absolutely correct. So type 1 diabetes can occur at any age. And if you add all the cases, because adulthood is longer than childhood, it is more cases that develop the disease in adulthood. The only difference is that it's probably not that acute and dangerous to be diagnosed with type 1 diabetes as an adult, because the development is a little bit slower. And so the acuteness and the also risk to develop a diabetic ketoacidosis is likely less as an adult. But it is true, we don't have so many data yet about screening adults, and it's probably something that has to be also explored in the future.
And of course, the thing about children is that you've got opportunities, because children have regular health checks, they have vaccinations, they have points in their lives at which to add an additional thing, check, wouldn't be too much of a problem, where of course in adults the system doesn't exist to be able to do that.
Yeah, I think there are some checkpoints where you can also get screened for type 2 diabetes. Of course it could be combined maybe for this, but absolutely right. What we are doing in the children, that we combine it with well baby visits or other vaccination visits in different countries, or school entry visits, and that is much better established.
I guess the other place for screening for adults might be at the booking visit for pregnancy, or even better at the kind of conception wellness clinics that spring up. I know 50% of pregnancies are unplanned, but there are quite a number that are planned, and people do tend to think about, am I up to date with vaccines? Do I need to sort this health problem out before I become pregnant? So that might also be an opportunity, I guess.
Yes. And even if you have, for example, for the subgroup of people who has gestational diabetes, it is actually quite important also to check whether 10% of people with gestational diabetes have actually type 1 and not type 2. So also here it is relevant, I think, to get tested, absolutely. So I think for the adults, there are not so many programs, but I agree that probably in the future that will be also more data available.
Well, it's a fascinating future. And I suspect that we will see childhood screening really quite widespread in the not too distant future. Is that your thought too?
Yes, it is, and I hope very much that it becomes reality.
Fantastic. Thank you so much, Anette Ziegler. And we'll be back very soon. Thank you for watching us.